What is the mission statement of Google Health?
Make everybody healthier by using information that's yours with your permission to allow you to lead a better life.
Our healthcare system is absolutely broken. I've talked about it time and time again on this channel, but one thing I've always been curious about is, can tech come in and revitalize our healthcare system? In this episode, I sit down with Dr. David Feinberg, the head of Google Health, formerly the CEO of UCLA Hospitals, to answer some of my questions about data and mental health during the COVID-19 pandemic. Are you ready? Hello, Dr. Feinberg, and welcome to my YouTube channel. Today, we're going to be talking about how Google is playing a role in healthcare and how I have a hope, and I feel like a lot of my fellow doctors have a similar hope, in how it can help save us and maybe bring some joy back to medicine, because we desperately need it. First things first, you're clinically trained as a psychiatrist. What are your thoughts on how COVID is affecting all of us, not just those in the healthcare community?
Well, first of all, so excited to be spending time with you. And I have that same hope that you have, that we can bring joy back to medicine and give people information that can be incredibly useful. I think what we're going to see post-COVID is our folks with COVID conditions that survive but have problems, neurologic, bleeding, etc. We're going to see a lot of acute care cases that didn't get treated, folks with chest pain now for 3 weeks that are showing up, a lot of chronic illnesses that didn't get treatment, a lot of immunizations, kind of the basics. But the other big wave that I think we're going to see is a huge amount of mental health problems. So we know there's a lot of prevalence of mental health issues before COVID. But now you add on to it the uncertainty and the fear around illnesses, the social isolation, the job loss. It's really coming together in a place where I think we're going to see astronomical rates of depression, anxiety. We know when the economy gets bad, we see diseases of despair like suicidality, alcoholism, increased substance abuse. That's coming. And that's not even counting the post-traumatic stress disorder that all these frontline workers, these nurses, ambulance drivers, docs in the health system are going to have.
What role do you think Google plays in perhaps mitigating some of that crisis?
A lot of folks come to Google and ask us questions. They ask questions about depression, about anxiety, about PTSD, about COVID. And we've really pushed to get validated screeners available right as you're searching. So you can do your own, in essence, screen for depression and anxiety. And then you see you're not alone. You get some kind of indication of maybe you're at high risk for this or not. And then we want to hand people off to treatment.
What do you think the role is of giving patients this screener before they go to their physician? Like, will I then be able to use that information they received from Google, or is that simply for the patient's own knowledge?
Well, the patient would have control of that, but the actual screener we're doing, for example, for depression is called a PHQ-9, a validated screener. As a psychiatrist, I gave out thousands of these. It's the same questions that you would ask in your practice. How's your sleep? Have you had thoughts about hurting yourself? So it's the same questions. Of course, we don't rule out thyroid conditions, etc. So it is not diagnostic.
I work in a healthcare setting, a primary care outpatient practice. I'm speaking with my health colleagues all across New York City, New Jersey. They're suffering with mental health conditions. The suicide rate for medical practitioners is higher than the general population. How can we help those individuals, those in the healthcare space?
Well, I think so much of it is cultural. And I think that us physicians could learn so much from our colleagues in nursing. I mean, I always think that when you're on the inpatient service and a patient that you've been caring for a long time passes away, the nurse caring for that patient is usually surrounded by other nurses. And those other nurses say, hey, let's get a cup of tea. Why don't I watch your patients? Why don't you take a break? The same team of doctors that are caring for that patient, when that patient dies, the other doctors go, oh, your census is down to 9. We can give you the next admission. Us docs are trained. We're supposed to be resilient. This stuff isn't supposed to affect us. We're not supposed to cry. We're not supposed to be human. And what we're seeing today in these frontline docs, they're falling apart because they're being asked for the first time in the developing world, not in wartime, to make rationing decisions they've never had to make before. If you get the vent and you don't get the vent. For the first time that I've ever seen, go to work and put yourself in harm's way over a very, very simple thing of protection that we've run out of, whether it's a gown or a mask. and bring it home to your family. So we've really stretched the concept of what our profession is. I think we can learn a lot from nurses. I think we've got to make sure all of our clinicians have the proper equipment. We got to give people time off. I mean, it's like a war. So you got to pull back and recharge. And not only this, you're taking care of these patients in this incredibly stressful situation. You too are going home and don't have enough toilet paper, and what are we supposed to do with the food? And my spouse just got laid off. So there's the double whammy of the world is falling apart, plus all your patients in the inpatient unit. So it's really stressful.
I couldn't agree more. And I think it really brings us to an interesting point of how broken our system is for providers. As physicians, we're faced with many new challenges that I think doctors of 20, 30 years ago were not facing, from electronic health records, heavy data entry, poor communication between systems. For example, if I'm in a room with a patient and we bring up that they should be getting a colonoscopy for a cancer screening, and they're not sure when their last colonoscopy was, it will take me 10 to 15 minutes to locate the colonoscopy report. Is it in the media section? Was it scanned in here? Is it part of the labs? Oh, it's in a different hospital. Now we have to sign this paper. It's just an absolute mess that is not only poor user interface, but also poor functionality when you think about who's using it. It's humans.
Imagine for that patient, we gave you a Google search bar that took all of the information on that patient from multiple EHRs, even in the same hospital that have different instances, all the PACS system, anything that ever got faxed in, anything ever on that patient. And you had a Google search bar and you just type in, has this patient had a colonoscopy? Or you're worried about anticoagulation and you type anticoagulation, and not only does everything come up, but so does hemoglobin levels. Even if you misspell it, we know that you're looking for penicillin. That's what we're creating. And we have it now. So we have partnered with Ascension, which has been an amazing partner, to say a couple of things. One, they wanted to use our cloud services. Two, they wanted to use our G Suite, but they wanted us to solve the problem you just described. I think that docs want to spend time looking in their patients' eyes. They want to spend time discussing what's going on. They want to spend time coming up with a plan together, not looking at the computer. And the response is spectacular. And they're like, oh my God, you have solved our problem.
I love that. And the patient-doctor relationship is so important to me. I even remember during my residency training, I would get in trouble because I would not finish my notes in the room because I would want to be with my patient. And then I would be delayed on my notes, and then I would be looked down as not completing my billing cycle, when in reality, all my patients were getting great care, they were happy with the services, my connection with them was solid, but because my notes weren't done on time, it created an issue.
You were healing, not coding.
Yeah,
so
exactly.
We want to get you back to healing and bring that, hey, we're good at organizing information. We're going to organize all your patients' information at your fingertips so you can do your healing.
When it comes to talking about health information and Google, the idea of patient privacy always comes up. The idea of whether or not this information is going to be utilized from a business standpoint. Is that true? Any validity to that? What say you?
I came to Google about a year and a half ago, and after working in healthcare for a while. And part of my coming was, are you going to let me treat these patients like they're my own patients? And I was convinced that the answer was yes. And since I've been here, I'm certainly convinced. Our model is, we think if we can get authoritative information and get people to care, that there's plenty of ways to then figure out what to do with it. If we ever take information and have it stored on our cloud, we follow the exact same rules as anybody else who's selling cloud services, and it's better than having your records stored in a warehouse, right, from that standpoint. There are times where we think we have tools that are really effective for doctors and nurses to take better care of patients, to make that electronic health record sort of hum. If we're going to be exposed to personal health information in that time, we follow, in this country, all the HIPAA laws so that we're doing the right thing with that information.
What would you say, maybe you even have this official statement ready, but what is the mission statement of Google Health?
We're working on the mission statement. We want everybody to live their healthiest life, right? So that's what we're trying to do. Make everybody healthier by using information that's yours, with your permission, to those you trust, to allow you to lead a better life.
What do you think happens before this screener was made available? When patients would type in, a search query about depression, what happened prior to it? Were they directed to quality sources or just the usual Google algorithm kicks in?
We're really trying, both on Google and on YouTube, to try to get the authoritative information up, the dangerous information away, and let's talk about the information in the middle. We want that as down far that it's hard for you to even find, right? So we're really trying to get that authoritative information. That could be a partnership with Mayo or the CDC or the WHO. If you went right now to Google and Googled coronavirus, we put in an SOS page. This is the first time that Google said for a medical condition, we're going to do this SOS. We've done it for natural disasters before. What is an SOS? It is a completely curated page. It has no ads. It's all authoritative information.
What do you consider as, I guess, dangerous information? If, in medicine in general, there's so many ways to disagree and not be inaccurate. Mayo Clinic may institute a treatment that other doctors may disagree with or see an alternative treatment to that. What is categorized as misinformation? What's considered dangerous?
If somebody does a YouTube video that says, drink this bleach, it cures your cancer, we take that off, right? That one's not hard to argue with. We find it very dangerous and unsafe. The question becomes, what about the YouTube video that says, drink carrot juice? It cures your cancer, right? So you and I might think, wow, that seems pretty outside the standard of the care, but it's maybe not going to kill the person. And maybe there's some benefit to it. It's clearly in the gray zone. We can't hide that information, but we certainly can make sure that we rank and bring up a bunch of authoritative information beforehand. So it's almost hard to get there. Now, if you're looking for your bias, the internet has it, right? So you could go find it, and that's great. And our job is to take the world's information, and in this case, the world's health information, and organize it and make it universally accessible to everybody.
I can easily understand why saying we're going to take down the videos of people drinking Tide Pods or eating Tide Pods, because that's directly causing harm and encouraging dangerous behavior. And then we have, I don't know if you're familiar with the two urgent care doctors who held their own press conference in Bakersfield, California. ABC News uploaded their conference. They definitely used a lot of misinformation in their conference. But now, are these voices allowed, or these dissenting voices allowed to be wrong, and they should be pushed down through the authority scores? Or should we be acting directly because we can see there is potential harm and potential danger there?
Yeah, those are the discussions we have every day. Right. And we want to engage in the community and help us figure that out. That's why it's not a Google or YouTube decision, but we bring in thoughtful groups to help us make those decisions. And it's iterative, right? And I don't think it's black and white.
I agree. I think because for me as a science communicator, the last thing I want is to shut down the conversation, looking at it from a long-term perspective. Like if someone puts out a piece of misinformation, we put it down, good, now it's not thriving on YouTube, because then YouTube gets a bad name for spreading misinformation. But long-term, I would love to create a solution, whether it's bringing in trustworthy creators or trustworthy voices to sort of give thumbs up in terms of accuracy. And like you see a USDA seal, you know what that means. I would love to see YouTube and Google be involved in a process like that.
So let me tell you how I think you're solving that problem that you're asking me. So let's talk anti-vax. So there's all these folks out there that say don't anti-vax. And when they put something on YouTube, it's engaging and thoughtful, and it's a story, and it's captivating. And what do we do as a health profession? We're still handing out pamphlets. So we got pamphlets against engaging stuff. What we need are more Dr. Mikes. We need more folks that know how to engage through these mediums that can get the message across that's authoritative and thoughtful, so that if you're going here for information, YouTube, for example, you've got the Dr. Mike competing very well. The pamphlet doesn't compete against, and sometimes not even pamphlet. Sometimes it's just
heavy data, basically. Yeah, like we're used to speaking amongst ourselves in the medical community and showing data to one another. But to a mom who's taking care of her child, that data is meaningless if someone's saying, "Oh, if you give these vaccines, they're going to cause serious harm." Correct. And you don't want to be responsible for that action. Right. At the end of the day, Google is a business. There's lots of competition in this space. Amazon is getting in on the health initiatives. What competition do you see for yourself? How are they different from what you're doing?
Yeah, so our competition, I think, is really clear. We're competing against diabetes, the opiate epidemic, suicide. We're competing against health inequities. We're competing in other countries where they don't have access to healthcare at all. We're competing the misinformation. That's what we're going after. If we get that right, I'm sure that the business will take care of itself. So I wish absolutely the best to Amazon and to Apple and Microsoft. And I think it's great that technology is getting into healthcare, but we've got to do it the right way. And I think in sometimes the competition, we should be above the competition, and very proud of our partnership with Apple around the ability to do contact tracing in an API so the apps can be developed so folks can, without us seeing any information, know whether they've come into contact with someone. So I came here. The mandate from leadership to me has been go help a lot of people. So that's what we're trying to do. We're trying to fight disease and keep healthy people healthy.
Well, I have to give you a huge thank you for making the time. This type of information is not only valuable to my subscribers, but we in the medical community, I ask my fellow doctors what their biggest frustrations are all the time, and I feel Google really has an opportunity to step in and make some major changes that will not only improve the outcomes for our patients, but also make the lives of doctors and other healthcare providers who are truly suffering as a result of a broken system. So for that, huge thank you to you.
Well, you're welcome, and so grateful for what you're doing and getting great information out there to the world. And so we really appreciate that.
Perfect. Thank you so much.